also avoiding alcohol or drugs before having sex, using a latex condom whenever you have any kind of sex. So these are the basic prevention steps for basically maximum sexually transmitted infections. So it should always be kept in mind. Next important section is clinical pharmacology and dermatology. So we will deal here with the study of drugs that are used to treat various skin conditions, and also what are the topical medications like the corticosteroids. Basically, they are used in eczemas or maybe psoriasis or dermatitis, or the topical antibiotics which are used in impetigo and folliculitis conditions, or topical antifungals which can be used in ringworm and athlete's foot, or topical retinoids again for treatment of psoriasis or maybe acne. So, other than this, we shall be discussing about the systemic medications, oral antibiotics for the acne, cellulitis, and erysipelas, and oral antifungal, which can be for candidiasis, fungal skin infections like candidiasis, oral retinoids, so used to treat severe acne, psoriasis, or immunosuppressants. Also biologics, so TNF alpha inhibitors, which are used for the atopic dermatitis and other inflammatory skin conditions. IL-17 inhibitors for the inflammatory skin conditions, psoriasis again, and IL-12 or 23 inhibitors used to treat psoriasis and other inflammatory skin conditions. Pharmacokinetics, we shall deal where how there is absorption, distribution, metabolism, and excretion, and pharmacodynamics, where we shall understand about the mechanism of action, dose response relationship, and side effects, and how there are drug interactions between topical medication interactions or systemic interactions, how there are adverse effects, cutaneous adverse effects like rash, itching, or blistering, or systemic adverse effects such as on kidneys, livers, and blood. And what are the protocols in pregnancy and lactation, the use of medications during pregnancy and the potential effects on the fetus, and lactation, the use of medications during breastfeeding and the potential effects on the baby. So to get in details of it, first we should understand the structure of the skin, which will help in further better understanding of various other factors. So the skin is the largest organ of the human body, and it plays a vital role in protecting us from external factors, and also helps in production of vitamin D. The layers of the skin includes epidermis, so the outermost layer of the skin responsible for protecting the body from external factors such as water loss, temperature, and mechanical damage. Then the layer beneath the epidermis is dermis, which is composed of connective tissue, blood vessels, and nerve endings. Then we have hypodermis, the innermost layer, and it is composed of subcutaneous tissue, fat cells, and connective tissue. Epidermal cells, epidermal layers usually is divided into multiple layers, which includes a stratum corneum. So that is the outermost layer of the epidermis, composed of dead skin cells. Then we have stratum lucidum, which is a thin layer, transparent, which is found only in the thick skin. Stratum granulosum, which is a layer of the epidermis where skin cells undergo a process called keratinization. Stratum spinosum, a layer of the epidermis where the skin cells are held together by desmosomes. And we have stratum basale, so that is the innermost layer of the epidermis where skin cells are produced through mitosis. So other than this, in the dermis we have papillary dermis, so the thin superficial layer of the dermis composed of loose connective tissues, and reticular dermis, so the thicker, deeper layers of the dermis is usually composed of dense connective tissue. In hypodermis, we have subcutaneous tissue, a layer of fatty tissue that connects the skin to underlying mucus, underlying muscles and bones, and fat cells. So adipocytes that store energy in the form of fat. Then we have skin appendages like hair follicles, sweat glands, sebaceous glands. So basically, in total, As far as the functions are concerned, so protection is one, regulation is another, sensation is third, and production of vitamin D through exposure to sunlight. So as I mentioned, skin is the largest organ. Prevalence of skin diseases in the general population is different in different geographical regions of India, varies from 7.9% to 60%. Adults constitute about 80.9%, and among them 59.9% males. Overall infections of the skin and subcutaneous tissues are the most common, 32.6%, followed by the disorder of skin appendages, which is 19.8%. Dermatitis, eczema is 18.8%, and acne is 16.7%. Psoriasis, urticaria, melasma, and vitiligo usually 3.4%, and then again 3.4, 3.6, 3.3% in patients respectively. So overview, so dermatological pharmacology is the study of drugs used to treat skin disorders, focusing on how medications interact with the skin structure and functions to achieve therapeutic effects, while dermatological therapeutics refer to the practical applications of these drugs to manage various skin diseases, including the topical treatments and systemic medications wherever necessary. So, as far as types of medicine which are used in dermatological practice is concerned, so topical agents, it includes creams, ointments, gels, and lotions, which is applied directly to the skin. So, usually corticosteroids is one of the uh, major category in topical medications, then topical antibiotics, topical antifungals, and topical retinoids and immunomodulators. And another part is systemic medications, which includes oral antibiotics, oral antifungals, oral retinoids, immunosuppressants, and biologics. And as far as phototherapy is concerned, so ultraviolet light therapy, which is used to treat skin conditions such as psoriasis, vitiligo, and atopic dermatitis. Narrowband UVB phototherapy, which is used to treat skin conditions such as psoriasis and vitiligo. And Sorolin plus UVA, which is PUVA phototherapy, used to treat skin conditions such as psoriasis and vitiligo. Laser therapy, so ablative laser therapy used to treat skin conditions such as wrinkles, scars, and skin cancers. Non-ablative laser therapy, which is used to treat skin conditions such as wrinkles, skin texture, and hyperpigmentation. And pulse dye laser therapy used to treat skin conditions such as port wine stains and hemangiomas. Cosmetic dermatology, usually botulinum toxin, which is used to treat facial wrinkles and frown lines. Dermal fillers, which is used to treat facial wrinkles, folds, and lip augmentation. Chemical peels used to treat skin conditions such as acne, hyperpigmentation, and skin texture. Microdermal abrasion used to treat skin conditions such as acne, hyperpigmentation, and skin texture. So principles of topical drug application usually aim at providing high concentration of drug at the site of application with minimal systemic absorption. However, therapeutic effects depend on the properties of drug vehicle which is used in skin lesions, and absorption of drug usually depends on lipid solubility of the preparation, state of hydration of stratum corneum, drug concentration in the vehicle, thickness of the skin, quantity applied, presence of inflamed skin, use of occlusive dressing. So moving forward towards the formulations part. So first is the topical formulations, which usually includes creams, the semi-solid emulsions of oil and water used for moisturization and treating dry skin conditions, and ointments. So semi-solid preparations of oil and wax used for treating dry skin conditions and providing occlusive barrier. Also gels, they are clear semi-solid preparations of water and gum used for treating acne, rosacea, and other inflammatory skin conditions. Lotions, so liquid preparations of oil and water used for treating dry skin conditions and providing moisturization. Solutions, so liquid preparations of active ingredients dissolved in water or other solvents used for treating various skin conditions. And other than these, we also have options of systemic formulations, tablets, capsules, injectables. So tablets usually used for treating conditions like acne, psoriasis, eczema. Capsules for treating skin conditions, and usually they are gelatinous capsules and injectables. So administered active ingredients are administered by injection for treatment of conditions like acne, psoriasis, and eczema. So basically, ointments are solid or liquid dispersed in non-aqueous base, preventing loss of heat and water. They are grease. They have greasy texture. Preparation is difficult to wash off, not easily spreadable. Creams are emulsions or of water and oil. So they are or oil and water. So vanishing creams, 20 to 80% water, less hydrating than ointments. Effective in both dry and VP exudative, less greasy, less viscous, and more spreadable. Gels are basically water-soluble emulsion, polyethylene glycols, alcoholic solvents, concentrate drugs that surface after evaporation, cosmetically favorable, easy to apply and wash off, especially to hair-bearing areas. Lotions are suspended drug solution, dissolved drug base, provide cooling effect, easy to apply to hair-bearing areas, spreads easily, rapidly, and less hydrating than ointments, and usually recommended for hair-bearing areas. Demulcents are inert substances which soothe an inflamed or denuded mucosa or skin by preventing contact with air or irritants in the surrounding. And usually, methyl cellulose, propylene glycol, glycerine, all these are the examples. And emollients are bland, oily substances which smooth and softens the skin, forms an occlusive film over the skin, preventing evaporation, thus restoring elasticity of cracked and dry skin. Olive oil, cocoa butter, hard and soft paraffin. Absorbents are finely powered, inert, insoluble solids capable of binding to their surface. Physical protection to the skin and mucosa, magnesium, skin talc, calamine, boric acid, starch. Astringents are substances that precipitate proteins but do not penetrate cells, so affect superficial layers only. Tannic acid and tannins and methanol at 50 to 90% zinc oxide, and irritants and counter irritants, so sensory nerve endings and induce inflammation, produce cooling sensation, warmth, pricking, tingling, hyperesthesia, numbness, local vasodilation, camphor, eucalyptus oil, methanol, capsicum. And other than this, as far as only the formulation parts are concerned, there are semi-solid formulations like foam, lightweight semi-solid preparations of active ingredients used for treating various skin conditions such as acne, rosacea, or eczema. Pasties like semi-solid preparations of active ingredients for eczema, psoriasis, and acne. There are transdermal formulations, patches, adhesive preparations of active ingredients used for treating various skin conditions such as pain management and hormone replacement therapy. Gels, already mentioned, they can be used for pain management and hormone replacement therapy yet again. Nanoparticle formulations are there like liposomes, so they are used for treating acne, psoriasis, and eczema. They are having active ingredients, so that is very useful for such conditions. And nanoparticles are tiny particles that are preparations of active ingredients used for treating various skin conditions such as acne, psoriasis, and eczema. So the routes of administration usually they are applied directly to the skin or mucous membrane. Oral, they are administered by mouth, by either or as a solid or a liquid. Parenteral routes, so administered via injection either intramuscularly, intravenously, or subcutaneously. Transdermal, which are administered through the skin, often using patch. Inhalation, administered through the lungs, often using inhalers. So dosage form, usually immediate release is there, release the active ingredients immediately. Sustained release is there, so it releases the active ingredients slowly over time. Controlled release is there, so it releases the active ingredient at a controlled rate. Extended release, so it releases the active ingredients over an extended period. So specialized dose forms, as I mentioned, nanoparticles, tiny particles used for targeted delivery, liposomes, tiny vesicles used for targeted delivery, transdermal patches that deliver medication through the skin, and implantable devices under the skin to deliver medications. So basically, implantable devices can be used for various conditions where we are looking for pain management or some other similar kinds of entities. Steroids, another important topic of discussion. which revolves around a class of medications that are commonly used to treat various skin conditions, including inflammatory and autoimmune disorders. So it is basically divided and classified into topical or systemic. And topical is applied directly to the skin. Systemic, they are taken orally or injected to treat systemic inflammation. So basically, mechanism of action revolves around anti-inflammatory effects and immunosuppressive effects. And as far as the mechanism of action is concerned, so binding to glucocorticoid receptors is one of the points where corticosteroids bind to glucocorticoid receptors in the cytoplasm, which triggers a cascade of events that ultimately leads to the suppression of inflammation, and there's translocation of to the nucleus. So the corticosteroid receptor complex translocates to the nucleus where it binds to specific DNA sequences known as glucocorticoid response elements. So there are transcriptional regulation also involved where corticosteroid regulates the transcription of various genes involved in inflammation, immune response, and cell growth. So as far as the effects of inflammation is concerned, so corticosteroids, they inhibit the production of pro-inflammatory cytokines such as TNF, alpha, IL-1 beta, and IL-6, and there is induction of anti-inflammatory cytokines. So corticosteroids induce the production of anti-inflammatory cytokines. There is inhibition of inflammatory cell infiltration, so they inhibit the inflammatory cells such as neutrophils and macrophages. So usually the effects revolve around the suppression of immune cell activation. So corticosteroids, they suppress the activation of immune cells such as T cells and B cells. There is inhibition of antibody production, which includes the production of antibodies by B cells. There is modulation of cytokine production, which are essential for coordination of immune response. And also, as far as the cell growth and differentiation part is concerned, so corticosteroids, they inhibit the proliferation of various cell types, including keratinocytes, fibroblasts, and endothelial cells. And also there is induction of cell differentiation, so it induces the differentiation of various cell types, including the keratinocytes and adipocytes. So usually we come across resistance and tachyphylaxis also. So resistance, if there is repeated use of corticosteroids can lead to resistance, but tachyphylaxis is the repeated use of corticosteroids, which can trigger the phenomena where the response to the medication decreases over time. So tachyphylaxis is an important point to note down. Also, there may be side effects. There may be skin thinning. There may be rosacea. There may be acne issues. There may be osteoporosis. So, long-term use can lead to osteoporosis. So, indications: corticosteroids are used to treat inflammatory skin conditions, example eczema, psoriasis, or dermatitis. Allergic reactions, example asthma or allergic rhinitis. Autoimmune disorders like lupus, rheumatoid arthritis, and organ transplantation to prevent rejection. The mechanism of action: the corticosteroids usually work by suppressing inflammation and immune responses. So there is inhibition and in the production of inflammatory mediators. Example, leukotrienes or the prostaglandins. And there is stabilizing of cell membranes and reducing permeability. So these are some important points to remember. As far as the side effects are concerned, so broadly we have immunosuppression, we have fluid and electrolyte imbalance, skin issues, altered sex hormones, increased stress response, altered protein fat metabolism, and effects on nervous system. So through this diagram, we can understand as far as the nervous system is engaged, so there can be mood swings, decreased libido, anxiety, depression, and seizures. In immune system, the infection can happen, or there can be oral thrush. As far as musculoskeletal system is engaged, we can clinically observe moon phase, buffalo hump, osteoporosis, truncal fat, or the muscle wasting. Integumentary system can elicit hirsutism or maybe stria, acne, ecchymosis. And if there is cardiovascular system involvement, then there is hypertension. Endocrine system, there is insulin resistance, hyperglycemia. Reproductive system can elicit amenorrhea, impotence, and infertility. So they are contraindicated in active infections, example tuberculosis, fungal infections, peptic ulcers, severe hypertension, diabetes mellitus, or pregnancy and breastfeeding, unless absolutely necessary. As far as the topical corticosteroids classification is concerned, so it is classified into 7 classes from class 1 to 7, starting from super potent to least potent. The duration of action varies from short acting to long acting, and the examples include hydrocortisone, triamcinolone, betamethasone, or clobetasol. These are the topical corticosteroid potencies. So, betamethasone dipropionate and clobetasol comes under the high potency category along with others in the list. And betamethasone valerate comes in the medium category, and low we have dezonite or hydrocortisone. So, this is a thing to remember because at times when we are in the treatment cycle, we have to understand the potencies and accordingly prescribe. So, systemic steroids potency varies from low potency example prednisone to high potency example is dexamethasone. The duration of action varies from short acting to long acting, and the examples include prednisone, which is low potency, methylprednisone, which is moderate potency, and dexamethasone, which is high potency again. So just to recapitulate the contraindication, there are active infections, there are peptic ulcer, there are severe hypertension, there is diabetes mellitus, and there is pregnancy and breastfeeding. Current topic is about biologics and immunomodulators. So they are class of medications that specifically will target molecules which are involved in inflammation and immune responses. So by definition, biologics are medications made from living organisms such as cells or proteins, and they will target specific molecules which are involved in inflammation and immune responses. Usual examples are tumor necrosis factor, which is the alpha inhibitors, infliximab or adalimumab, and interleukins are 12 by 23 inhibitors, interleukin 17 inhibitors, or interleukin 23 inhibitors. Next in this category is immunomodulators by definition, which are medications that are modified that modify the immune response. So immunomodulators target specific molecule which is involved in inflammation and immune responses. So the example is cyclosporin, an immunosuppressant that inhibits calcineurin, azithromycin, which is will inhibit purine synthesis, and methotrexate, so that will inhibit dihydrofolate reductase. Usual indications are in psoriasis, where they can be used to treat moderate to severe psoriasis. Psoriatic arthritis, which are used for a category is used for treatment of psoriatic arthritis condition, and atopic dermatitis another condition, moderate to severe atopic dermatitis, it is clearly indicated. And as far as other indications are concerned, in rheumatoid arthritis and Crohn's disease and ulcerative colitis, these can be used. Also, there are certain side effects, so increased risk of infection, allergic reactions, injection site reactions, or systemic side effects such as nausea, vomiting, and diarrhea. So regular monitoring should be done. There should be regular blood tests just to monitor the side effects and efficacy. There should be regular skin examinations just to monitor for skin cancers and other skin conditions. The vaccination status should be monitored, as biologics and immunomodulators can increase the risk of infection. A number of biologic medications has been introduced to treat psoriasis and other diseases such as atopic dermatitis. These are some of the examples which I mentioned, which are mainly monoclonal antibodies directed against TNF alpha inhibitors. And also there are intravenous immunoglobulins, targeted anti-neoplastic agents. So these are all for so in the mechanism of action, the work is usually by directly interacting with specific components of the immune system, either by stimulating or suppressing immune responses depending on the drug, to target and module the body's inflammatory response in conditions like autoimmune diseases and cancer. So as far as biologics is concerned, so tumor necrosis factor alpha inhibitors, infliximab binds to TNF alpha, preventing its interaction to TNF receptors. Etanercept binds to TNF-alpha, preventing its interaction again. And adalimumab it will bind to TNF-alpha, preventing its interaction with the TNF receptors. Interleukin 12 by 23 inhibitors, it will bind to P40 protein subunit of IL-12 and IL-23, and interleukin 17 inhibitors will bind to IL-17A. The secukinumab is one of the prominent names in this regard. Also, if we consider immunomodulators, so they are calcineurin inhibitors. So cyclosporin, it will inhibit calcineurin, a protein phosphatase that activates T cells, thereby reducing inflammation. There's purine synthesis inhibitors like azathioprine, difolate reductase inhibitors like methotrexate. And as far as the overall cycle is concerned, so first point which we need to note is about the inhibition of cytokine production. So biologics and immunomodulators will inhibit the production of pro-inflammatory cytokines. As far as inhibition of T cell activation is concerned, they will reduce inflammation. After that, there is inhibition of B cell activation, which will reduce inflammation, and then there is modulation of immune responses, so thereby it will reduce the inflammation. So this is a very good diagram to elicit all these phenomena, so should be noted. Here we have different biologics and immunomodulators as to what is their exact functionality, as methotrexate is dihydrofolate reductase inhibitor and is utilized in moderate to severe psoriasis. If we consider vinblastine, it will inhibit microtubule formation. It will be usually used in Kaposi sarcoma and advanced disease formations. Azithromycin is there, which is purine synthesis inhibitor. So it will be used in pemphigus vulgaris, bullous pemphigoid, atopic dermatitis, chronic actinic dermatitis. Cyclosporin is a calcineurin inhibitor, and so it was used in psoriasis, and similar examples are there. Important category is retinoids. Basically, retinoids are a class of medication that are derived from vitamin A and are commonly used to treat various